Thank you very much, Honorable Chair. And I want to take this opportunity to welcome the team. I have some issues. One is on performance for 2024-25, which is at 29.6%. And one of the explanations is that it is as a result of delays in procurement. I don't know who is responsible for the delays. We need to know. But even when you say they are being addressed in quarter three, we really need to know. For me, I believe that a ghost that talks does not kill. So all these procurement processes are well laid, but it seems you don't follow them to do the procurement at the right time. My second issue is on oxygen plants. Honorable Chair, I would like to know how much oxygen do we need? How much oxygen do we need in a regional referral hospital? I remember the other day when the regional referral hospitals were presenting, I think some have one oxygen plant, others have 2 oxygen plants, others have 3 oxygen plants. So how much oxygen do we need that maybe one day we shall say, here we are and we are done? Another issue related to oxygen is it was something to do maintenance, where there was money, additional resources after BFP, and the Ministry of Health allocated 25 billion for funding for oxygen, 25 billion. And when you look at the unfunded, there is also, was it 8.6 billion for transformers and the other things. I'm wondering how much maintenance is this that requires 25 billion and you cannot get out of this 8.6 billion to do the procurement of transformers that will stabilize the power supply for the new acquired medical equipment. So we need you to share more details on this, the 25 billion. My next concern is on the 16 health center forces that are under infrastructure improvement. You have talked about the 3 health center forces that are being upgraded to general hospitals, and you have indicated them: Rukochi, Mitoma, and Muko. Much as we are not sure of the justification for these particular ones, may be clear for Kasese, but we are also interested in knowing these 16 health center forces that are under infrastructure development. We need to know their status, because my friend here was saying the Rukonjiri Health Center forces were functional, but the Rukonjiri Health Center 4 is non-functional, which is at the center of my municipality. It is at the center of the district. Good enough, a theater was constructed. It is now going to finish a year without functionalizing it, without equipment. And many times I've tried to follow this up, but it is not easy. I think I've visited the PS, I think 2 times without finding you. And even when I call you, you don't pick. Even when I give you WhatsApp, you keep quiet. And you are exactly, I think it's the engineer or team who is also like that. Completely. I call and you don't, I send a message, nothing. So the Rukunjiri Health Center for Theatre was completed, though it also has challenges, because the theatre itself communicates to the outside through the ventilation. And I've already, I think I communicated to some of your colleagues. They seem not to be having a solution. So these health center forces that are non-functional should be given emphasis. I don't know how many they are in the country, those without a theater, those without, you know. So I am requesting that you put emphasis on the non-functional health center forces. At Rukunjiri Health Center 4, they are now constructing a maternity. So when I don't, I want to imagine that is in the 16. But once you don't mention it or you don't capture it, I get worried. So I want to know the 16 and the status. My other big concern is on health insurance. Our Honorable Minister, as the health committee, maybe if we have not talked about it, but we are basically very much disappointed with this bill. Much as we say accordingly it has been delivered to cabinet for since 2023, is the president sitting on this bill? Or you need to tell us exactly what is the problem? And to make it worse, on the issue of interventions to mitigate the sector challenges, number one is the national health insurance. So how are we going to improve our health system if this national health insurance is stuck in the State House, is stuck in cabinet, and it can never come out? I've said it many times that if it cannot come through cabinet, then you allow us as a committee of health, we bring it ourselves. Otherwise, you are doing very badly on national health insurance. And if the president has interests in this, they should be declared. Actually, next time when we go for caucus, I may raise it so that I ask him, I say, according to ministry, since 2023, you were given this bill. What's wrong with it? And why are you not, you know? But yes, I will, definitely. But that is on assumption that it is true that this bill was delivered. Lastly, thank you very much. There was the unfunded priority, 2 billion for CHOOS. I don't know what the emphasis you want to put on these CHOOS, but 2 billion, when you look at all these monies, you got 136 billion, and you couldn't get only 2 billion to handle the issue of CHOOS. That makes me think it is not a priority. But for sure you have a lot of money to handle the CHOOS. Thank you, Honorable Chair.
Thank you, Honorable Tahigwa. Sekyanzi of Wodiope.
Chair, today it would have been a very marvelous meeting with this different ministries, but unfortunately, there is an important ministry, that is finance, that the minister is not around. You know, the person you send cannot be and cannot perceive like the real one you are sending to the message. We've been crippling for a long time as health committee, and we wanted the finance ministry, really, the minister himself to be here, because we are taken for granted for a long time. Chair, we've been on this committee so far 4 years, but I don't know why this committee is taken for granted, yet we have our country at heart. Most of the members who are on this committee, we love our country, and we help this government really to plan very well and to provide the services as it is required. But ministries, sometimes you let us down. For example, this Ministry of Finance, Chair, we call it independently, I request, Chair, because when you look at Annex 8 here, Chair, you are finding no funding provided, Yet there were some of priorities for this committee, and I wanted to ask the finance minister, and you people who are representing him, go and ask him on my behalf, where did who gives him the first priorities for different agencies or different committees? Because as a committee, if we say our priorities are these ones, then after the time you find no funding is provided, are you taking us for granted? We are here useless? Do we waste our time to come here? I wanted to hear this one from the finance committee. Chair, not only that, now we are talking of new ambulances to be procured. Indeed, I don't know. We have here a department, I had them introducing themselves. There's planning department, from planning department, commissioner, this. We know the number of constituencies we have in the country. Why do we plan for some constituencies, then we leave others? Don't you have a tool to guide you? I wanted you also to answer this, because now we also in this, now we are budgeting, we are requesting for another budget for some constituencies. Why can't we tackle something and we say this one is done, is finished forever and ever, rather than doing halfly, piecemeal, this one? How do we plan for our people? How do we plan for our country really? Is it kind of corruption? What is it really? If I know that I have 10 people, and I have to serve them, why do I cook food for only 5? Yet I know really I have 10 people. So, our people, we request you kindly help us as we are planning, that if it is this, if we've decided as a committee that this number of constituencies have to get ambulances, let's plan for all the numbers of the constituencies we've given you. Now, for example, and I wonder how you plan, Chair. A district, for example, like Nakasongola, has no general hospital, and it is a very big district, twice. bigger than Chibuku district. I'm telling you, just a constituency, my constituency is bigger, twice bigger than Chibuku district, a constituency. But you find a constituency has no health center has no, the district has no general hospital, and this is the constituency without ambulance being allocated. It has no the other hospitals. Why can't we again plan and say no, as they have no this, at least let them benefit in ambulances so that the people within there get services from other areas where you provided. But you find also that one, nothing. How do we really plan? So I request that this time, my good minister and everyone, that Nakasongola should not miss at least the ambulances. Because even the other time we missed the whole 2 constituencies, none of the constituencies got the ambulance. And here we have no general hospital. I expected to find here Nakasongola among the general hospitals to be constructed. Nothing. Yet it is in Central. For sure, this thing beats my understanding.
And you're requesting for a seat, I remember some time back?
I have requested chair. For 4 years, I'm requesting for general hospital in Nakasongola. 4 years, I'm here requesting. Then, actually, I want just to thank in your team and the ministry that at least you gave me a word for Naviswera, but still, it is demanding. So I request, although I've seen here, but Honorable Minister and the colleagues, find a way how you can fix in Nakasongola for the general hospital. Even the X-ray, imagine, Honorable Minister and Chair, both chairs actually, the Dr. Yonga and my grand here. You know very well Nakasongola. Moving from Kafo to Kampala here, just for X-ray services. Someone to move all that long distance, imagine. At least let us have an X-ray at Nakasongola, whereby even the Morata people can cross, the other Chiriandongo. We are well located for sure, by God. But in service says, we lack a lot. I thought as we are well located, even the services should be well located and provided. But it is Nakasongola which cripple. And in your planning, you do tend to forget Central. I don't know why. I've seen here, you've constructed 4 dispatch centers, ambulance centers. In Central here, I don't know even a single one. If it is there, but it needs to be dissected. Because, yes, at least we have 4 or 2. Because all these regions come here. You see? These neighboring districts, Central is very big. That's why you find Nakasongola is in Central, Luero is in Central, these other districts are in Central, but we are crippling. For you, you look at only Kampala here, but it is not only Kampala which makes up Central. Even these other districts make up Central. So we should not be looking at only Kampala. Let's also look at the peripherals of the Central. That one, it will help us. Finance, I request you kindly, we also want to retain our positions, as you don't want to leave those offices, even as we don't want to leave them. This man of ambulances, it is be provided for these missing constituencies. Let this money be provided before we go for elections. Because even if you are the one, your colleague here has an ambulance, the other one, the neighbor, and now the voters start, you see, the other one is the one who is working. For them, they have the ambulance. What do you have? What have you brought? More so like us who sit on this committee for sure. You tell your voters that you say I sit on the health committee. Now, others who don't even sit on the health committee, they have the ambulances, constituency ambulances, for you who sit there, and us, you are just looking at us. Really, finance, indeed help us. This time, we don't want to see, actually, I don't know my colleagues who have not benefited and we sit here. Actually, this one, it will be our indoor discussion. If you don't provide us the ambulances this time, we shall also see the way to handle you.
Finally,
Chair,
that's the final submission.
okay, when we meet them in the park. By the way, sit also in park. Yes.
So you
Chair,
stand,
thank you.
you stand warned.
I
I think that was just a commercial break. Honorable Edakas. Edakas first wait. Honorable Nekesa.
Thank you, Chair. Chair.
6 include the following. Following the execution of President Trump's executive orders, the U.S. government withdrew financing, resulting into funding shortages that totaled $604 billion. And the following key programs have been affected. I beg not to read them again because I had previously read them. 2, increment of shillings 2 billion is required as counterpart funding for Community Health Extension Workers Program that is currently supported by donors to strengthen disease prevention and promotion of public health activities. And the donors are winding up. 3, wage for national specialized hospitals, Uganda Heart Institute, 3.8 billion, Uganda Cancer Institute, 3.3 billion, the Specialized Women and Neonatal Hospital at 4.6 billion to make them operate at an average of 60% of their current staff structure. Chair, I request to answer this phone call. Chair, I request that the PS takes over as I answer this call.
Number 3, wage for National Specialized Hospital. I think this she had finished. Number 4, wage for National Referral Hospitals. Mulago, that is 7.3 billion. Butabika, 2.8 billion. Chirudu, 4.5 billion, Kawempe, 12.3 billion, and Naguru new staff structure for trauma center, that is 7 billion, to facilitate operating at 60% of the current staff structure. Number 5, wage for regional referral hospital, that is Entebbe, 4.5 billion, Gulu, 1.7 billion, Yombe 6.6 billion, Lira 1.2 billion, Soroti 0.5 billion, Kabale 2.8 billion, Kayunga 3 billion, Mbale 3.4 billion, Jinja 2.8 billion, Hoima 3.2 billion, Fort Portal 3 billion, and this will facilitate them to operate at an average of 60% of their staff structure. Number 6, 6 billion is required, 5 billion is required for operationalizing Uganda Organ Donation and Transplant Council and facilitation of the Uganda Medical Board to reduce on the referral abroad. And this chair has been such a long-standing priority. We still continue sending people abroad, yet this would really transform our operations. Number 7, shillings 48 billion for rehabilitation, expansion, and equipping the 3 old rehabilitated general hospitals that have been started on by UPDF Brigade. Here, specifically, we're talking about Masindi, Kambuga, and Itojo hospitals. Number 8, maintenance of new imaging equipment, and that is CT scan, MRIs, and ultrasound that requires 7 billion annually. Number 9, 8.6 billion is required for procurement of transformers that will stabilize the power supply for the new equipment, especially the medical equipment that are newly installed. Chair, as you may be aware, the equipment we have installed in our hospitals are worth billions, far, far above 8.6. If we do not provide the stabilizers to protect the power surge, we are likely to lose this equipment. Number 10, maintenance and functionalization of current fleet of ambulances under the National Ambulance Call and Dispatch System that requires 17.6 billion. And of this, we require 12 billion, and then also the service of maintenance of 5.6 billion. Establishment of the National Ambulance Service System requires 12.8 billion to be phased over 3 years, whereas 54 billion is required to procure 158 ambulances for constituencies that have not been allocated any ambulance. This remains a big gap. Number 11, Honorable, I want to hand over. I'm just going to number 11.
Chair, I appreciate you for giving me that short break. Number 11 is 3.6 billion, which is needed for supporting blood mobilization activities, testing and storage, given that additional 3 regional blood banks have been completed and will become fully functional. Then we have 3 billion needed for establishment and functionalizing the point of entry health units in Entebbe, Malaba, Busia, Vura, and Chanika, and shillings 4 billion to support operationalization of the national and regional public health emergency operation centers to respond to outbreaks. 13, 12 billion required for laboratory equipment and reagents annually to avert the chronic shortage of laboratory reagents, supplies, and equipment for all hospitals and health center 4s. 14, 4 billion required for rollout of electronic medical records for the system. 15, 2.4 billion required as non-wage recurrent costs for national health laboratory operations that was funded by donors who have scaled down their funding. We have 9.6 billion required as Global Fund co-financing for HIV, TB, and malaria. And lastly, 27 billion is required to mitigate the funding gaps across all votes for non-communicable diseases, including community sensitization and medical supplies. Chair, lastly, is the non-tax revenue. The ministry collected Uganda shillings 93.6 million as non-tax revenue in financial year 24-25 from sale of bid documents and dispose of old vehicles, and these funds were remitted to the consolidated fund. The non-tax revenue projection for financial year 25-26 is 250 million. 13, status of submission of requirements of the Public Finance and Management Act 2015. Attached are relevant documentation as per the requirements of the Public Finance and Management Act 2015, Section 13, subsection 15. Annex 8 is update on the status of implementation of the parliamentary recommendations on the National Budget Framework Paper and Ministerial Policy Statement for financial year 24-25. Annex 10, the annual and 3-month work plan and outcome, the objectives, outputs, targets, and performance indicators of the work plans and outcomes. Annex 11, the annual procurement plan for the vote. Annex 12, the cash flow projections of the vote. Annex 13, a certificate issued by the minister responsible for finance in consultation with the Equal Opportunities Commission, certifying that the policy statement is gender and equity responsive, and specifying measures taken to equalize opportunities for men, women, persons with disabilities, and other marginalized groups. This is expected from Ministry of Finance. Lastly, Annex 14, the asset register of the vote in the format issued by the Accountant General. Chair, I beg to submit.
Thank you, Honorable Minister, for your presentation.